Good morning or good afternoon, everyone. It's really a pleasure to be here with you today. My name is Alessandro Iellamo, the Senior Emergency Nutrition Advisor for FHI 360. In emergency, when health systems collapse, food security deteriorates, and safe water becomes scarce, infant and young child feeding IYCF practices becomes a matter of survival. We know that recommended IYCF practices, particularly exclusive breastfeeding, can prevent undernutrition, reduce disease, and save lives. Yet, in humanitarian settings, these practices are often disrupted. Parents and caregivers are displaced, traditional support systems may vanish, and frontline responders lack the tools and the data to act decisively. This is why FHI 360, with the support of ACF and many experts from the Nutrition Information System Working Group from the infant feeding in emergency core group, have worked together last year and the years before to develop a very comprehensive guide for infant and young child feeding in emergencies assessments. And, and this is to answer this question, the questions that I know we all kept asking ourselves. So how do we really understand what's happening to infants and young children in an emergency? Until now, until this new guide, there was really no standardized field-ready tool to assess infant and young child feeding in emergencies. And we know, we documented how this left humanitarian actors without consistent methods. Methods to determine the extent of the IYCF disruptions, method to identify gaps in support and services to infant and young child feeding, or also methods to justify targeted interventions to donors and decision makers. And we know we have documented many questions that all practitioners kept asking, no, and sometimes with no clear or consistent answers until now. But with the guide, we hope that these questions have been answered. So questions like, what's the right sample size for my IYCF assessment? Or how can I integrate properly an IYCF-E assessment into a broader SMART or nutrition survey? And how many FGDs or interviews are enough, no, to be considered for my assessment to be considered robust? Or how do I design a robust qualitative assessment that holds up under any scrutiny? So the absence of clear guidance meant many times that our response effort were often maybe delayed or maybe are not aligned with the actual needs. That's why this new guide is really important. We feel it's very important. And we know it finally answered these questions in a very practical and, as I said, field ready way. So as I started this presentation, I said that to close this gap, FHI 360, supported by ACF UK, and I hope my colleague Alexandra, the Director of Nutrition, is on the call, developed in collaboration with technical experts from the IFE core group as well as the NIS working group, this comprehensive IYCF-E assessment guide. The guide is a practical step-by-step resource for collecting, analyzing, and interpreting IYCF data in humanitarian and fragile contexts. So the guide enables the user to understand the feeding and caring situation of infants and young children, select the appropriate IYCF indicators and data collection methods, and make evidence-based decisions before, during, or after an emergency. So whether you are an implementer whether you are a technical advisor, whether you are a cluster coordinator, this guide will hopefully help you to act faster and certainly with greater precision. The guide includes essential tools. We have included an orientation deck that covers the 6 modules that are included in the guide. The modules of the orientation deck provides for exercises and quizzes for people to better understand how to use the various aspects, the various recommendations of the guide. The orientation deck is ideal for using national trainings or subnational trainings, cluster capacity building, or when you want to onboard new staff that will work on assessments. Then we have 2 important practical tools: an analysis worksheet, that basically a structured template that helps consolidate and interpret the IYCF-E data available from key informant interviews, FGDs, surveys, and other secondary sources. Third, we have included a sample size calculator. This is a user-friendly Excel tool that answers questions like what's the sample size what should be the sample size if I want to measure accurately exclusive breastfeeding. Again, each tool is intuitive, field tested, and adaptable to your operating context. As we all know, as emergencies become more frequent and complex, we really need to make sure that our responses are guided by accurate and timely data. The IYCF-E Assessment Guide is a public good for all of you, for the global nutrition and non-nutrition community, I would say. It's ready for immediate use. So what we encourage you to do is to download the guide and explore its tools. Use it in your next emergency assessment. Use it in your current emergency work. Use it for preparedness planning. Please do share it with local partners, government stakeholders, and donors. And be aware that now the guide is available in various languages: Arabic, English, French, and Spanish. So let's really ensure that every emergency response protects the right of infants and young children to safe and adequate nutrition and care. Thank you so much for your time, and please reach out if you have questions or need further clarification.